Natural and home remedies for dysfunctional uterine bleeding. In most cases, heavy vaginal bleeding is related to abnormal hormone levels that upset the menstrual cycle. However, it can also be the result of disease, infection, or pregnancy complications. Dysfunctional uterine bleeding. The term dysfunctional uterine bleeding is used to describe heavy vaginal bleeding that isn't caused by a serious medical problem. In most cases, heavy, often irregular bleeding is related to abnormal hormone levels that throw off the menstrual cycle. Dysfunctional uterine bleeding is not used to describe vaginal bleeding caused by medical conditions such as miscarriage, uterine growths such as fibroids, cancer of the cervix or uterus, or blood diseases. If you are having heavy vaginal bleeding, your health professional must rule out these other conditions before diagnosing you with dysfunctional uterine bleeding. There are two types of dysfunctional uterine bleeding: anovulatory, caused by a low level of the hormone progesterone. Progesterone is necessary for the ovary to regularly release an egg, as well as for regulating menstrual bleeding. Low progesterone causes irregular and heavy menstrual bleeding. This type of dysfunctional uterine bleeding is common before age 20 and after age 40. During these times of transition into and out of the fertile years, it's normal for progesterone levels to be variable. Ovulatory: as many as 10% of ovulating women have dysfunctional uterine bleeding despite having normal levels of progesterone and other hormones. In these cases, no hormonal or other cause can be found. Experts do not fully understand this type of dysfunctional uterine bleeding and its causes. Symptoms of dysfunctional uterine bleeding. You may have dysfunctional uterine bleeding if you have one or more of the following symptoms. Menstrual bleeding that occurs more often than every 21 days or farther apart than 35 days. Menstrual bleeding that lasts longer than 7 days. Blood loss of more than 80 milliliters each menstrual cycle. If you are passing large clots or soaking a large pad per hour for 8 hours, your bleeding is considered heavy. Dysfunctional uterine bleeding diagnosed. Dysfunctional uterine bleeding is a diagnosis of exclusion. This means that your health professional has ruled out other medical causes of vaginal bleeding such as miscarriage, pregnancy complications, or disease, and common and less serious causes such as adenomyosis and uterine fibroids. Your health professional may conclude that natural hormonal or other processes are causing your symptoms. If you have had heavy or frequent vaginal bleeding for 3 or more menstrual cycles, or your symptoms are affecting your daily functioning, see your health professional. By reviewing the frequency, duration, and amount of bleeding you have been having, combined with a pelvic examination, urine test, blood tests, and possibly an ultrasound, your health professional will be able to check for a number of causes of your symptoms. A biopsy of endometrial tissue may also be helpful. Dysfunctional uterine bleeding treated. A number of treatment options are available for dysfunctional uterine bleeding. Some are meant to return the menstrual cycle to normal, others are used to reduce bleeding or to eliminate menstruation. Each of these options works effectively for some women but not others. Treatments include: progesterone has been shown to help prevent overgrowth of the endometrium, which prevents dysfunctional uterine bleeding. Heavy bleeding is often the product of irregular breakdown of the endometrium in teens and women who aren't ovulating regularly. Progesterone promotes ovulation, restores a predictable cyclic monthly menstrual period. Nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, can curb heavy uterine bleeding. Use of the levonorgestrelid, which releases a progesterone-like, synthetic hormone into the uterus. This reduces bleeding while preventing pregnancy. It has many side effects, and before committing to this, understand what you can be up against. Hormone treatment. A short course of high-dose estrogen therapy is often used to stop dangerously heavy bleeding. For ongoing treatment, a daily birth control pill or progestin pill regulates the menstrual cycle, reducing bleeding and cramping. Rarely used medications that stop estrogen production and menstruation, such as gonadotropin-releasing hormones or danazol. These medications cause severe side effects but are used in special cases. Surgery, such as dilation and curettage, D&C, for short-term relief of severe bleeding, or endometrial ablation for longer-term relief of bleeding. In cases of severe uterine bleeding, blood transfusion may be used to quickly restore needed blood volume before a longer-term treatment is used. In uncontrollable cases of uterine bleeding, the uterus may be removed, hysterectomy. Treatment options: surgery. Surgery is generally reserved for treating dysfunctional uterine bleeding that can't be controlled with medication. The following procedures are used to treat dysfunctional uterine bleeding. Hysteroscopy can be used to diagnose and treat dysfunctional uterine bleeding at the same time. When areas of bleeding are located, biopsies can be taken and then the areas of bleeding can be treated with either a laser beam or electric current, electrocautery. Endometrial ablation is a minimally invasive alternative to hysterectomy when other medical treatments fail or when you or your doctor have reasons for not using other treatments. Endometrial ablation scars the uterine lining, so it is not a treatment option if you are planning to become pregnant. Hysterectomy, the removal of the uterus, is done when a sample of the uterine lining, endometrial biopsy, shows abnormal cell changes or cancer, when uterine bleeding is uncontrollable, or when the cause of chronic bleeding cannot be found and treated. Some women prefer hysterectomy to medications with troublesome side effects. However, a hysterectomy is a major surgery with risks of complications, which requires a prolonged recovery and long-term estrogen replacement therapy after surgery. Dilation and curettage, D&C, is sometimes used to control sudden, heavy vaginal bleeding. It is the quickest way to stop bleeding in the uterus. Dysfunctional uterine bleeding is a medical condition in which there is excessive uterine bleeding. Although the causes behind it have not been fully understood by the experts, but sometimes it can be caused due to low progesterone. Some of the common symptoms of dysfunctional uterine bleeding are blood loss of more than 80 milliliters, menstrual bleeding that lasts longer than 7 days, and menstrual bleeding which occurs more often than every 21 days. Home remedies. There are several home remedies for dysfunctional uterine bleeding which are simple and are quite safe to use without any risk of side effects. Some of the popular home remedies for dysfunctional uterine bleeding which are being used since a very long time and have proved to be quite effective in many cases are: one of the simplest home remedies for dysfunctional uterine bleeding is to consume a well-balanced diet. A diet rich in iron, which will be very helpful in making new blood cells in your body. Consume food such as eggs, beans, red meat, green leafy vegetables, shellfish and iron-enriched cereals and breads. Garlic is considered to be one of the most efficient home remedies for dysfunctional uterine bleeding. All you have to do is consume 5 to 6 cloves of garlic on daily basis, which will reduce the discomfort and pain caused during heavy bleeding. Red raspberry tea can also be used to treat this problem. Consume this tea on daily basis, which will help to regulate menstrual flow by giving strength to the wall of the uterine. Natural progesterone cream can be very beneficial in treating dysfunctional uterine bleeding. Apply this cream on chest and upper arms just before 2 days of menstrual period. This home remedy will help to control the flow effective. Shepherd's purse is very effective in stopping the bleeding. Take a glass filled with water and then add 1 teaspoon of shepherd's purse in it. Allow it to soak in the water for next 2 hours. Consume this liquid 3 times in a day between your meals. Consume fruits rich in vitamin C on daily basis. Vitamin C is very helpful in making the body absorb iron in a more effective manner. Strawberries, orange and lemon juice are rich sources of vitamin C. Consuming Indian gooseberry is also very effective in treating this ailment, and it helps in controlling the bleeding and gives relief from the pain. It is also a rich source of vitamin C. The bark of Ashika tree is also very effective against dysfunctional uterine bleeding. All you have to do is take 16 ounce of water, 4 ounce of milk and 4 ounce of bark of Ashika. Boil them together in a low flame and wait for the water and milk to evaporate. Now allow the remaining part to cool down and then consume it 2 to 3 times in a day. The above-mentioned home remedies for dysfunctional uterine bleeding are some of the most popular natural remedies. These home remedies are simple to use at home and are quite cheap.